Climate Change in Nursing webinar series today. This webinar series aims to support dialogue on the important topic of climate change in nursing. Before we begin today, I would like to take a moment to respectfully acknowledge that CASN's national office is located on the traditional unceded territory of the Algonquin people. I would also like to go over a few housekeeping items. Please note that today's session will be recorded. The recording will be posted on the CASN site and shared through CASN's network as part of the dissemination strategy for this project. We would like to know how many of you are in attendance today, and if there are more than one person in your room attending this session, please indicate it please indicate the number in the chat function. That would be great. Thank you. Today's session will begin with presentations from our speakers and will conclude with 30 minutes of Q&A and discussion. After the presentations, we will take questions. You may do this through the chat function on your screen, or alternatively, you're welcome to unmute your microphone and ask your question directly to the speakers. Please make sure though that your microphone remains muted during the presentations, and if you're not speaking during the Q&A, in order to prevent any interference. Today's session of this series, we will hear from Morgan Magnuson and Shannon Vanderberg. Morgan and Shannon are both nurse educators in the Faculty of Health Sciences at the University of Lethbridge, located in Lethbridge, Alberta. Their background is in public health nursing and has enabled them to bring public health issues such as climate change, infectious disease spread, and communicable disease control into the courses they teach, helping students gain a practical understanding of relevant health issues in Canada and around the globe. We will also hear from Michael Foley, web designer of the e-resource and founding partner of technology companies Pixelera, Member 365, and Savvy Sail. Holding a deep understanding of database development and web design, as well as interactive media, Michael has been involved in the many aspects of the information technology field over the past 25 years. Today, Shannon, Morgan, and Michael will share information on CASN's soon-to-be released Climate-Driven Vector-borne Diseases and Nursing e-resource. To hear more about this work, I'll now turn the session over to our presenters so that we can begin. So I'll turn it over to Morgan and Shannon. Thank you.
Thank you, Andrea. So today we're going to talk about the e-resource that has been created, and we're going to focus more specifically on the vector-borne diseases piece of the e-resource. So I will talk a little bit about the overview of the project and the e-resource design. And then Morgan will also talk about what the modules will look like. Last week we spoke about module 1, which focuses on climate change, and today we're going to focus more on modules 2 through 4. And Morgan will also talk about how to integrate this into teaching and learning. And then Michael will be presenting an overview of what the actual e-resource looks like. The Canadian Association of Schools of Nursing gratefully acknowledges the expertise, time, and contributions of all those who engaged in this project for the development of the educational guidelines and now the accompanying e-resource. We extend special thanks to the multiple stakeholders across Canada who have provided and continue to provide their feedback and expertise. And we are particularly grateful to the patient advocates and committee members representing persons with lived experience of vector-borne infectious diseases who offered their time and expertise to inform this project, as well as those who shared their expertise during the gender and Indigenous consultations. CASN gratefully acknowledges the guidance and oversight of the Canadian Indigenous Nurses Association in planning and implementing the Indigenous consultations for this project. This project has been supported by the Public Health Agency of Canada's Infectious Disease and Climate Change Fund, which addresses the impact of climate change on human health in Canada. So now I'll just provide a brief overview of our project. In August 2018, the Canadian Association of Schools of Nursing received funding from the Public Health Agency of Canada to conduct a project titled Empowering the Next Generation of Healthcare Professionals with Knowledge, Skills, Tools, and Supports to Address Infectious Disease Related to Climate Change in Canada. And the timeline for this project, as I mentioned, it began in 2018, and the targeted end date is this year. The goal of this project is to increase the knowledge of the effects of climate-driven vector-borne infectious diseases on population health in Canada among nurse educators, and to foster the integration of this knowledge into Canadian nursing education programs. The target audience, there's a primary and secondary target audience for this project. The primary audience is schools of nursing, and the secondary audience are registered nurses, practical nurses, nurse practitioners in hospitals, community settings, within national and provincial nursing organizations, physicians, physician assistants, medical laboratory and diagnostic imaging personnel, and so on. So a very wide audience that this project will target. To achieve the project goal, the following activities were carried out. So the first one was the development of national evidence-informed consensus-based guidelines for nursing education, to build nursing knowledge and capacity, to engage in public health activities related to infectious diseases transmitted by insects and ticks that are emerging and or expanding in Canada as a result of climate change. These guidelines have been completed, and I will address them later on in the presentation. And we are currently working on an e-resource to facilitate and foster the integration of the health effects of climate change and infectious diseases in schools of nursing across Canada, which is what we will show you some of that today. The Climate-Driven Infectious Disease Committee was a group of dedicated experts in climate-driven infectious disease and nursing, and they developed the domains and learning outcomes which are included in the guidelines for undergraduate nursing education on climate-driven vector-borne diseases document. And this is a continuation of the committee members. The guidelines for undergraduate nursing education on climate-driven vector-borne diseases is currently, these guidelines are currently available on the CASN website. The document is organized into 5 domains. The first one is public health, vector-borne infectious diseases. The second domain is populations exposed to potential risks. The third domain deals with primary and secondary prevention. The fourth with treatment and tertiary prevention, and the fifth domain addresses advocacy. 34 detailed learning outcomes accompany each domain in the guidelines. This is just a snapshot of the e-resource site, which will soon be launched, and it will be available on the CASN website. And Morgan and I were 2 of the content experts for the e-resource, along with June Kaminsky and Andrea Harvey. They were also engaged in the content development. And then, as Andrea already mentioned, Michael Foley is the web designer, and he's going to speak to the actual development of the e-resource. So I'm going to pass it off to Morgan now, who's going to talk a little bit more of the e-resource design and how it can be incorporated into teaching and learning and course development.
Thanks, Shannon. So I'll talk a little bit about how we designed the e-resource, and then, like Shannon said, talk a little bit about how it could be integrated into nursing programs. So first, the e-resource is an open access online teaching tool, and it's designed as a toolkit to support current and future nurses Its goal is to address the content that would provide nurses with the knowledge and skills needed to work with individuals, clients, communities, and populations facing climate-driven infectious diseases. So before I talk specifically about some of the content that's covered in the modules, I wanted to talk a little bit first about what our guiding principles were. So the first guiding principle is that we understood the need for interprofessional and intersectoral collaboration. That's really important when dealing with really complex issues like the prevention of vector-borne diseases. We also recognize the importance of sensitive language and behavior that considers the beliefs of individuals and communities about climate-related health effects. We also wanted to respectfully acknowledge Indigenous peoples and their respective territories, demonstrate an understanding of their cultural strengths, as well as knowledge of the systemic, historical, and contemporary traumas unique to Indigenous people. All that information is crucial in working alongside Indigenous communities, families, and individuals. And lastly, we recognize that there are multiple ways of knowing. So as Shannon mentioned, the e-resource is organized into 5 modules, and they address the learning outcomes related to CASN's guidelines for undergraduate nursing education on climate-driven vector-borne diseases. So each module represents one of the guidelines domains, with domains 2 and domains 3, the ones on populations at risk and primary and secondary prevention. Those 2 are combined into one module. And we also, the first module is an introductory module that really discusses kind of some foundational knowledge about climate change and its impacts on health. The 5 modules are dynamic and user-friendly, and they all use a standardized structure. They also integrate interactive and dynamic learning tools, such as case studies, self-assessment quizzes, and virtual patient scenarios. And we estimate the time to complete each lesson within the module at about 20 minutes, with each module containing 3 to 4 lessons. So today we're talking about climate change and vector-borne diseases, and there are 3 modules that deal specifically with that topic. So module 2 focuses on vector-borne diseases in Canada. The module explores the key mechanisms of how climate change will impact the frequency and distribution of vectors in Canada. The module introduces 2 important vector-borne diseases, Lyme disease and West Nile virus. Module 3 explores the relationship between climate change, vector-borne diseases, and the social determinants of health. The module also speaks to the importance of interdisciplinary teams in addressing vector-borne diseases in terms of surveillance and prevention activities. And module 4 covers the challenges, controversies, and best practices regarding the diagnosis and treatment of vector-borne diseases. And this module also really highlights the lived experiences of people who have vector-borne diseases. This table shows how each module and lesson within those modules is linked to the guidelines. So module 2, lesson 1, which really focuses on the transmission of vector-borne diseases and the vector-borne diseases that are found in Canada, covers learning outcomes 1.1, which speaks to epidemiology, and then outcome 1.10, which speaks to surveillance. So as I mentioned earlier, each of the modules has a standardized structure, and I'm briefly going to go through each of those elements on the following slides. So each module begins with a slide that discusses the key concepts covered in each lesson. So the example here is from module 2, which begins with the discussion on climate change before moving on to some foundational knowledge related to 2 significant vector-borne diseases in Canada, again, Lyme disease and West Nile virus. Each lesson within the modules contains specific learning outcomes. The purpose of those learning outcomes is just to alert the student as to what knowledge, skills, or attitudes they should gain through completing each lesson. To help students with their learning journey, a really prominent feature of the modules is the use of nursing characters within specific case studies. So one of the most prominent characters in modules 2 to 4 is Stella, who is a public health nurse. You can see her on this slide. In Module 2, we see how Stella addresses a learning gap she has in relation to vector-borne diseases. We also see how Stella encounters Rhett, a young child who she sees in a well-child immunization clinic. And we learn that Rhett may have contracted Lyme disease. In Module 3, we see some of the interdisciplinary work that Stella is engaged in relation to the surveillance and prevention of vector-borne diseases in her community. And lastly, in Module 4, we see how Stella acts as an advocate for Rhett, ensuring he receives the proper diagnosis and treatment for Lyme disease. And there are lots of other nurse characters that are highlighted in the modules. For example, Module 4, Ronnie, another community health nurse, uses telehealth technology to connect with one of her clients who is experiencing persistent symptoms of Lyme disease. To give you an idea of how the modules look and how students would interact with them, I'm just going to actually pull up the modules themselves. So this is from Module 2. This is, a good example of what the module looks like. So we can see Stella here, our character, and she discovers some information about Lyme disease. Students are then encouraged to click on each one of these items to learn a little bit more about Lyme disease. We can navigate to the next slide and, some information on the transmission of Lyme disease. And then lastly here we see the life cycle of the black-legged tick. So this just gives you an idea of how the content is presented in the modules. So in addition to all the interactive features in the modules, we've also integrated integrated critical thinking moments really throughout the modules. So the purpose of the critical thinking moments is to help students connect the content that they're learning in the modules to their nursing practice, but also to the broader social political context. So in addition to encouraging students to reflect on those questions on their own, we also think these questions could be used in other ways depending on the needs of the program. So for example, the critical thinking moments could be used as the basis of other assignments, such as a reflective journal or a paper. They could also be used as a part of group discussions during synchronous learning. There are lots of instances throughout the modules where students are prompted to browse additional resources just to help them gain a deeper understanding of the topics that are covered in each of the modules. And lessons and modules end with a summary slide that highlight the main take-homes of that lesson. So you can see here, this is an example from Module 4, where Ronnie, who has dealt with a client that has persistent symptoms related to Lyme disease, how she becomes more aware of those symptoms, and how challenges related to the diagnosis and treatment of Lyme disease intersect with the social determinants of health to create inequities. At the end of each module, there'll be 3 to 5 self-assessment questions, and students will get feedback based on their answer. So you can see here in this little video how students would interact with those self-assessment quizzes. So those quizzes are meant to allow learners to monitor their own understanding of the material and also to apply content that's covered through the case studies. So that's how the modules look. Next, I just wanted to speak briefly to how we solicited and integrated feedback on the content and the presentation of the modules. So we engaged with a diverse group of representatives from multiple sectors who provided feedback on the e-resource, and you can see that list of groups here. The initial content, when it was in pretty basic PowerPoint form, was reviewed by content experts in the spring of 2020. We also received feedback from a broad range of stakeholders during the summer of 2020. And then the e-resource was reviewed again by stakeholders throughout the fall of 2020. So we really valued all the feedback that we received, and we paid specific attention to gender, Indigenous perspectives, and those with lived experience. We took a consensus approach to the feedback among the content developers and CASN, and we made extensive revisions after each round of feedback. Additionally, CASN will be integrating a feedback mechanism on the e-resource website with a goal of gaining further understanding of how educators and learners are finding this knowledge product. The feedback shared will be used for future updating and will also inform the development of future knowledge products that CASN creates. So we really do feel that all that feedback has really strengthened the modules and that they should improve nurses' understanding on the impacts of climate change on vector-borne diseases, as well as improving the care that nurses provide to those people who live with vector-borne diseases. The last thing I'm going to talk about is how you might consider using the e-resource in your program. So first, I think one of the strengths of the modules is that they do align with current competency and guideline documents. So first, the entry to practice public health nursing competencies for undergraduate nursing education. Those domains are highlighted, including the domains about applying public health science to nursing practice, population and community health assessment and analysis, as well as the domain on partnerships, collaboration, and advocacy. The e-resource also aligns with the NCLEX test plan in the sections related to advocacy and health promotion and maintenance. And lastly, we all know how climate change is a threat to the health of Canadians. So academics and nurse leaders have called on nursing education to integrate climate change curriculum to support nurses in addressing both the adverse health impacts of climate change, but also for advocating for climate change response policy. So the Canadian Nurses Association and CASN have recognized the importance of integrating climate change and sustainability curriculum within the Canadian schools of nursing. So we do understand the time commitment needed to complete the modules, but when we're thinking about how you could integrate this into your own program, I think there's a great deal of flexibility in how the modules can be used. Each module is standalone, and it's not a requirement that students complete the modules in order or that they complete all the modules at all. So you can pick and choose which modules fit your program best. We also think the modules align well with many courses that are currently offered in a lot of nursing programs, so courses in community and global health. So anything that has a focus on environmental risks or prevention, health promotion, those types of nursing courses, we think this content would be a natural fit. Additionally, with the COVID-19 pandemic, it's prompted many nurse educators, including those in our program, to shift away from traditional face-to-face learning, at least for now. So if you're like our program, you may have integrated strategies such as the flipped classroom, where students are introduced to content at home, and then that learning is reinforced and expanded on in synchronous sessions. So kind of that opposite of the traditional lecture then homework strategy. So one way a flipped classroom approach could be used is that students could complete the module work independently. And then the critical thinking moments that are found throughout the modules could be used in synchronous sessions. So educators could use strategies such as small and large group discussions or world cafes or Zoom breakout rooms to explore the critical thinking moments, as they do really encourage students to make the connection between the content to broader concepts such as the social determinants of health and public policy. And lastly, I wanted to give you an example of how the modules might be integrated into our curriculum at the University of Lethbridge across a variety of courses. So in the third year of our program, our students will take a theoretical course on health promotion. They'll also participate in their community health clinical, and they'll also at the same time take a course on leadership. So we see the potential for the modules to be integrated into all three courses with the content on climate change and vector-borne diseases being integrated into our health promotion course, while the practical component of environmental scans, community risk assessments, prevention and promotion planning being integrated into our community clinical course. And then lastly, the climate change and vector-borne disease advocacy modules would be a great fit in our leadership course. So just to give you an idea of how the modules in the e-resource might be used. So next I'm gonna pass things off to Michael, and he's going to provide you with some information about how you can access the e-resource.
Thanks, Morgan. So one of the challenges we had is that this module is available to educators, students, and professionals. So in terms of getting it into their hands, we've created some knowledge around that. So on the website, at the very bottom of the middle of the first page, there's an area where you're going to be able to identify who you are. And when you click on that, and you, for example, as an educator, Morgan, if you want to go to the next slide, you'll be able to download the actual courses in 3 different methods. One is a full package of modules. So these are going to be zip files that you can, or it's a single zip file that contains all of the modules. You'll be able to download each module by themselves as a zip file, or you can actually come to the VBD website to access any of the modules. All of the modules can be uploaded into your own organizational LMS. So most universities now have an LMS system that you can use. So if you downloaded all 5 modules, you can actually use all 5, and you can reorder them in any way that you want, and use the LMS features to track student progress as they go through the courses. Alternatively, you can actually send students or professionals to the website, and we have created a course curriculum, as you can see here. So all 5 modules are listed down the left-hand side, and you can go through each one of the modules at your leisure. So we wanted to create as many different formats as possible for you to be able to gain access and provide these resources. Sorry, I just talked about this one too. So downloading them, and you can provide them to your educational LMS operators, and they'll be able to upload them into the system and present the course in whatever way that you wanted to. In terms of the timeline of this, around this time last year, we actually kicked off the production on this. We met together here in Ottawa, and during the months of January through February, we went through the content creation. We spent the summer vetting the content together and providing it to our test groups for feedback. In late 2020, we started the actual testing of the modules themselves, and we're in the process of wrapping them up, and the translation is happening as we speak. Our intent is to release all of these modules in spring 2021 and through the website itself and through any kind of communication that CASN is going to do. And with that, I'll hand it back to Andrea.
Hi, Andrea, are you still there? You might be on mute if you're talking because nobody can hear you.
Thank you. Okay. Thank you to Shannon, Morgan, and Michael for your wonderful, insightful presentations. I believe we had some questions submitted prior to the presentation. I'll have to check with Julia on that. And at this point, we're happy to entertain any questions and comments, or we really welcome your feedback as well, as this is part of our KT strategy. And so please feel free to use the chat box function. And alternatively, if you would like to make a comment, you can unmute and just ask your questions or your comments. And yeah, so we'll spend some time to invite your questions.
Andrea, I think there's a question from Debbie in the chat. Debbie, I don't know if you would like to write your question, or you're welcome to unmute and speak to us via the Zoom audio.
So maybe we'll give her some time to, maybe she's typing the question. We had some comments as well that this can be incorporated into a global health and EPI course. So that's, yeah, absolutely. That's a great suggestion. So Debbie's asking how to unmute. You should see, if you hover your cursor over your picture, you should see a little microphone on the lower left side in your picture.
I just got it. Thank you very much. I wanted first to start with thanking you for the incredible amount of work that has gone into creating this project. I'm really excited about the new resource. Very much looking forward to investigating more. I'm a nursing teacher at the John Abbott College in Montreal. We devote one of our classes to Lyme disease and West Nile virus in the second semester. We've done so for the past 3 years, and I really see the potential for bringing these modules and integrating it into that class. But also I appreciate the ways that you have shared, Morgan, how you integrate it into your institution. We also have a community health section that 6th semester students are exposed to, and it can definitely be brought in there in developing clinics or developing preventive methods for the students to think about. So I really appreciate the way that you've shared how your institute has integrated them, and I look forward to doing the same at our place. I have one question, and that is how, I know that Michael, you said they'll be available in spring of 2021. That's coming up soon. How can we access these modules? Is there going to be a cost in doing so? Is it open to the public? How do we go about doing that?
Maybe I'll take this one. So so Debbie, there is no cost. It is open access to anybody that's interested, whether you're a healthcare professional that's just wanting to learn more about the topic area to enhance your own practice, or if you're a student or an educator. So the modules will be housed within the e-resource website, which is what we were showing you earlier. And that is not live yet to the public, but when it is, it will be linked directly from the CASN website. So I would encourage you to visit CASN sometime in April and just look out for that. I do want to share that anybody that's attending these webinars will also get an email notification when we have gone live with a direct link, so that you get the news that it's launched and ready to use when we go live.
That's great. Thank you very much.
Okay, great. Thanks, Debbie, for your comments and questions. Anyone else? Any questions for Morgan, Shannon, Michael on how to access or how to use? I have a question, Michael. You said that the modules can be downloaded individually. So I'm assuming once you download them, could you also have an individual selection of which slides you wanted to use? Because I've seen that for some of the modules, there are sometimes up to 100 slides in one module. So those are a lot of slides. And so depending on how much time you have for your individual classes or in the course, is there a possibility to even pick and choose individual slides from the once you download it?
You're not going to be able to pick individual slides, but you are going to be able to pick either a module, like a module 1 through 5, or you can pick a lesson within the module. So each module has, as Morgan said earlier, anywhere between 3 and 5 different lessons. And each lesson is about 20 minutes approximately it takes to do them. So anywhere between 15 and 25 slides per lesson.
Right, thank you. So we also have a comment or question here. This would be a good professional development for faculty as well. We are shifting some of our focus to community/home care in PSW. Anyone know what? I'm not familiar with that acronym. I would benefit from this and can incorporate it. So absolutely, as a professional development activity, yes, I think it absolutely lends itself to, you know, if you're in a public health office or working in home care or wherever. I think, yeah, for nurses that are out in the field, that would be an excellent resource. Maybe if Morgan or Shannon wanted to comment on those ideas.
I'll just quickly interject that PSW is personal support worker.
Right. Yeah, thanks.
The term is different in every province, so.
Sure, I can speak a little bit to that. So yeah, although I think the primary target audience is in nurses and nursing students, I do think there is some opportunity there for other for professional development. And I think the pieces in the modules that speak about that really focus on intersectoral action and interdisciplinary action and the different parts of the different health professionals, but also just, you know, when we're thinking about vector-borne diseases, people like veterinarians and other community members that play an important role in vector-borne disease surveillance and prevention. We also get an idea of some of from the modules, the roles that those groups of people have. So I do think that's one of the strengths of the modules. I hope that speaks to what you were hoping to.
Thanks, Morgan. And I believe last time, the first webinar, I believe there was a discussion around possibilities of giving certificate. And I think Michael sort of had some comment around that, how that could be built into the learning management systems, or how the certificate idea would work. Maybe you can comment again on that for those that did not join us last time.
Sure. Within an organizational learning management system, there typically is the ability to award a certificate of completion. And these can be set up either by lesson, by module, or by doing the entire course. So that can be determined when the educator is actually uploading the application into the learning management system.
Great, thanks, Michael. I'm just having a quick look at the chat box here. Again, Debbie mentioned that flipped classes have become quite common now during our online teaching, but she can also see that this certainly has potential when we, you know, go back to our usual methods, using this as a flipped ideas for flipped classrooms. Then we have a question: is there an expectation that all nursing programs in Canada should be using the modules? Is it considered need to know, nice to know, or not to know? What is the expectation of CASN regarding the required curricula? That is it's a good question. Yes. Does anyone want to take a first stab at that question? Julia or maybe I can just give a comment to that in terms of expectations. Well, CASN certainly is the organization that accredits our programs, and we have over the years, or CASN over the years has developed many entry-level competencies. And when we developed these educational guidelines, we really try to keep in mind that we have, for example, the public health nursing entry-level competencies. So we really try to develop this resource so that it is congruent and a good fit with the public health nursing entry-level competencies. And those are expectations that curricula would be integrating the entry-level competencies. And of course, we also recognize that curricula are really full of content, and very often if you want to bring something new in, you need to make a decision what goes out. And because of that, we were trying to have a product that you can fairly easily integrate into a variety of courses, a module here, a lesson there. And so, yeah, so we're hoping, of course, that it will be taken up. And then considering really the urgency of climate change, and it's actually a climate crisis, as many people are talking about it, I think it is really very timely and incredibly useful resource to get our students to focus on the role of nursing in climate change, and bringing in these very, very concrete examples of how vector-borne diseases have a huge population health impact. And as we developed the resource, we had a lot of participants from the community who have the lived experience, and we heard horrendous stories, and they affect all determinants of health. They affect people's complete lives. I mean, from being on chronic disability to going on unemployment, losing your mortgage and your housing. Families are breaking down because of these chronic conditions. So it affects all determinants of health. So I mean, I'm obviously a huge advocate for this, as you can see. So I think it needs to be in a program. So I'm not sure if anyone else wants to comment on this here. Morgan, Shannon, Michael, Julia.
Andrea, that was actually my question. So thank you very much. I think you did answer it. I'm coming from multiple perspectives. So I was one of your reviewers for your modules. So that was exciting for me. I'm also an educator with BCIT. And thirdly, I actually have experienced a parent with Lyme disease. So I'm also coming from that lived experience. So I think what we've done is fabulous here. And my question really was sort of to the point of how are we going to get all of these educators and institutes on board, because I think it's so important that we start incorporating this. But I'm worried that, like you said, content is already full. What are we going to pull out to put in? And I know Amanda's on board with us today from BCIT, and she's done some work at integrating modules already for us. But I am worried about other schools and how important this is going to seem to them.
Yeah, no, great questions here. Anyone want to sort of respond to that, Morgan or Shannon?
Yeah, that speaks to the need for nursing programs to remain current with what's happening across Canada, right? And as Andrea said, climate change is really, really important, and it should be integrated within nursing curriculum. So, it's our hope that nursing programs across Canada recognize that this is really important to include in nursing curriculums. And I think sometimes there's the piece that gets discussed at curriculum committee meetings and things, right? What's really important for us to include in our curriculum. And that's where we hope that across Canada that programs see the need for material like this within curriculum. So I think it really depends on the educational institution, but we hope that with all of the research coming out with climate change, vector-borne diseases in Canada, that it becomes the need to know piece of nursing curriculum in Canada.
Yeah, and I'll just follow up with Shannon, what Shannon had said about our own about our program at the University of Lethbridge, and we are going through a curriculum change right now. And I think one of the things that came up in a lot of those early discussions about is, you know, are we educating nurses for today, or are we educating nurses for the future? And how can we be future oriented in the way that we educate our nursing students? And I think climate change is certainly a really big piece of that, you know, not just thinking about the needs of today, but anticipating those needs of the future. So I do think that it should be prioritized in that way, because in the future, our students are going to need to think about the health implications of climate change.
Absolutely, thanks. Amanda, you have your hand up?
I'll just follow up. Sorry, I have my mask on because I'm in the simulation lab today, but I'll follow up on what my colleague Jennifer was saying, that it has taken a lot of advocacy to the curriculum team and other faculty about the importance of this content being integrated. And so right now, we only have it integrated in our theory courses, but there's a lot of hesitancy to emphasize it in clinical practice, even in the public health area. So I think these kinds of resources and coming from CASN are so valuable, and I'm so thankful for the work that has been done around this. I think it also speaks to, I know for myself, I didn't have training for this when I started in nursing school 17 years ago. So I think there's a lot of faculty development that needs to happen as well, and the resource is going to be valuable. So I just want to thank you, and I do acknowledge it is a bit of a slog kind of getting buy-in.
Thanks, Amanda. Wonderful responses here also in the chat box, some suggestions on how people are thinking that it could be integrated. Also reference to a pathophysiology teacher who might be interested in using that, or that there are there is a developing new courses. Obviously, there will be opportunities, and there are climate change committees and so on. So there are some really nice suggestions in the comment box on how the resource could be integrated into the curriculum. So that's wonderful. I will have a question here. Is climate change and web a requirement in the national framework and for accreditation? Well, I guess it's similar to the question we had before, whether it's a need to know or nice to know. As far as I know, and Julia, correct me if I'm wrong, it is not specifically articulated in the accreditation framework. But again, it's, you know, the urgency of climate change and being current with our nursing education. I think, you know, sort of we discussed it. So I can't say it's a requirement. I'm not sure if Julia wants to add anything to that. So
we actually, like, our accreditation body is very separate from the rest of the organization for obvious reasons. So I can't really speak to what is the requirement. However, Amanda, if you're really interested, I can direct you to my colleague, Joni Boyd, who is the manager of CASN's accreditation program, and she'll certainly be able to respond to you with more information on that.
And I think another way to advocate for it and integrate it in the curriculum is almost to look for champions within your program, to look at the resource and see how you can integrate it in your course, but also then have this a conversation with your colleagues who are teaching perhaps the leadership course, or even research course, or are trying to incorporate more indigenous content or the ecological determinants of health into their courses, so that you basically go and market it within your own program to say, well, you know, I'm using this and I was thinking perhaps this part might be useful as an example of advocacy in somebody else's course. And so you know, many of my colleagues are happy if they see new examples to their content. And so again, it is to find these champions within the programs that then basically show your colleagues how they could integrate it into other courses, which would be fantastic if it's taken up in several courses and not just one course, because it also helps students to connect the dots between the courses that, you know, obviously advocacy can take many forms, and here we go. This is an example of advocacy, how you can, you know, do that to support communities or individual clients that have been infected with you know, those vector-borne diseases. So that's another strategy.
Andrea, I think there was a comment from Carrie Beasley. Carrie, did you?
Hi, how are you?
Yeah, jump in here.
Yeah, I just want to say thank you. My name is Carrie Beasley. I'm actually one of the contributors, and I'm also a researcher on the Canadian Lyme Disease Research Network, and I've actually had a fair bit of input to a number of the guidelines across the country for a number of years. And one of the important points I think that sort of has to be made, I think, is to make everyone aware that there is a 30-year history of controversy in Lyme disease, and there are literally 15 or 20 different guidelines out there. Personally, I'm actually another Lyme horror story that was basically, I was a hair's breadth from ending up, I was basically paralyzed, going to be blind, almost needed a pacemaker, and almost ended up on a ventilator many, many years ago. And one thing I've noticed over time is that, and this is positive, is that nurses have very regularly been the people identifying and advocating on behalf of patients. And I really look forward to seeing more nurses with the knowledge and perhaps RNs and RPMs with prescription privileges that could help people, because there seems to be far less dogma in nursing than there is with the medical system because of the old controversies. So I really, again, one thing that people really do need to be aware of is that there are controversies and disagreements with Lyme disease, and sadly that is hurting people and unlikely to change in the future. And you also have to be aware it's not just Lyme disease. You know, you mentioned West Nile virus. There's all sorts of other viruses, bacterial, parasitic infections from mosquitoes. You can get Lyme disease from a mosquito bite. Most people aren't aware of that. In endemic areas, that does happen. We know what happens. We don't know what percentage. Same with treatment. You know, it's gotten a little ridiculous lately where there's claims that testing and treatment are 100%. They're not. You know, they give you 2 pills and say you're cured. There's people that have been on a lifetime of antibiotics and they're still finding chronic Lyme disease and there's many other vector-borne diseases that most doctors have not heard about. Some transmitted by ticks, some transmitted by mosquitoes. Bartonella is a big one, for example, different parasites. So I thank you for the opportunity, and I hope that helps raise awareness to save people this, because it's something that is, I think it's mostly preventable, and hopefully that will be corrected over time. And so far I've seen the nurses have actually led the charge more so than the doctors and infectious disease societies. Thank you.
Thank you for sharing your story. It's always incredibly powerful, I find, to hear first voice accounts, and again, the important role of advocacy in nursing to really support your clients. And as you said, in many cases, clients are a lot more knowledgeable about all kinds of diagnostics and treatments and so on. And it's a difficult journey sometimes through the healthcare system if you're affected with a disease like that. So advocacy is a hugely important role. So thank you for sharing that. Yes.
Yeah, and it is important to realize that, again, there are these controversies. I've been on 4.5 years of antibiotics. I am a PCR confirmed case that, you know, some groups would tell you doesn't exist. I would have shown you, I literally had an IV PIC line for intravenous antibiotics for 2 years. It helped dramatically, but it's still not gone. There's a number of people, if you don't catch this early, it can take months to years to lifetime of treatment for some people. And it's really just a question of what percentage. Can't really say, but there seems to be a significant number of people that if it's not, the important point is to catch it early if there's any suspicion. Yes. So thank you.
Yeah, thank you. Yeah. Any other comments or responses that you would like to share with us?
Yeah, so thank you for sharing your experience, and I hope that in the module, specifically I think module 4, we do speak to a lot of the challenges and like you said, controversies related to diagnosis and treatment. So you know, the hope is that like you said, a lot of people aren't aware about all those controversies. So the hope is with the modules that nurses will gain a better understanding of the current context of how Lyme disease, but also, like you said, other vector-borne diseases are diagnosed and treated in Canada, and that because of that, they will provide better care, and they will be better advocates for their patients who do experience a lot of barriers in receiving adequate diagnostics and treatments.
Yeah, Amanda, you have your hand up. One last question.
One last question I have is, so we do integrate climate change and vector-borne disease in the global health class. And I'm wondering about the modules, if they have consideration for the global burden of vector-borne disease, what we can learn from other countries and regions that have a high burden of vector-borne illness, and some of the kind of cross-border learning that we want students to be attentive to.
Yeah, so Shannon and I also teach the global health course in our program. So we are, you know, we do cover a lot of that content in the course. The majority of the content around vector-borne diseases in the modules is focused on Canada. There is some information about travel, acquired vector-borne diseases, but we don't go into detail about vector-borne diseases like dengue fever or any of those vector-borne diseases that, you know, we don't see very commonly in Canada unless they're acquired through travel. So although we speak to the importance of really thorough travel assessments of people who are presenting with symptoms that can't be accounted for, it's not necessarily the focus on those other vector-borne diseases of global importance, but we do point them towards some documents that do go into more depth about some of those vector-borne diseases of global significance.
Wonderful. Well, thank you again, Shannon, Morgan, and Michael, and thank you to everyone who participated today. Please note again that the recording of this session will be made available on CASN's YouTube channel and circulated to you in the coming days. Please feel free to share the link with your networks. And thank you again. And CASN certainly hopes you will consider attending the upcoming sessions of this webinar series. So visit the CASN website and search for CASN Climate Change in Nursing webinars for more information and to register. And CASN will be sending you a feedback survey in the coming days to hear your feedback on the e-resource. And please also look for this in your email folder. So thanks again for your participation. Be well and stay safe. Thank you.